Today I am going to talk about one product which is very harmful not only for our health but also for the health of our planet, that is tobacco. Myself, Dr. Vaibhavi Patel, I am a consultant pulmonologist at Navachethana Hospital, Bangalore. Every year we observe World No Tobacco Day on 31st May. The theme for this year is Protect the Environment. This theme is very aptly designed by WHO for this year, as tobacco growing is also very harmful for our earth. Lots of forests are cut every year to clear the place for tobacco plantation. The chemical oil which is added in the soil and even in the water, it is also very harmful for our planet. This tobacco, it's not harmful for only us but also harmful for our human health also. So the ill effects of the tobacco are cancer, chronic respiratory lung disease, heart disease, then premature births, stillbirths. Lot of infants are dying very at early age. There are multiple chances of getting reinfections again and again, diabetes, eyes problem, dental problem. Why do people smoke? So what do you think? Once somebody starts smoking, nicotine is a very strong stimulant in the brain, and for transient period of time you get the sense of happiness and stress buster. But this happiness doesn't last longer, as it is very addictive. Nicotine, once you start smoking, you always feel craving for nicotine every day. That is how people get addicted to smoking in their day-to-day life. Once the patient came and asked me, "Doctor, can I smoke 1 cigarette per day? Is it okay?" Then we have convinced him there is no negotiation for number of cigarettes per day. Even if you are smoking 1 cigarette per day for your lifetime, that has the same ill effects as we have with the more number of cigarettes. The association of tobacco smoking and cancer is so strong that there is hardly cancer in our body which doesn't have association with tobacco. Tobacco smoking causes even chronic respiratory lung conditions. Smokers always have complained that they have on and off breathing difficulties, early morning sputum, then there is problem in chest pain on and off, heaviness in the chest. All these symptoms are frequently observed in smokers. About 60% of smokers always want to quit in their lifetime, one or the other time. But hardly any of them get support for medical advice or the family support. So the road to quit smoking starts with the willingness to quit smoking, and it requires complete family support and a good medical advice. So let's make this world tobacco free, and let's join hands together to help smokers to quit tobacco. Have a nice day and thank you.